that makes me happiest about OMD is that it continues to be highly clinician focused. It has got the trust of the family doctors, nurse practitioners, and other primary care team members across the province.
I hope that walking away from this conference, the physicians here will say, I've found the community. These are like-minded people. There are others who are interested in this, and they also had a chance to talk to the vendors, the other practice management people, talking to those in ministry or in various areas of healthcare, and seeing that there is a united move in terms of digital health, and that they're very much supported.
We all know about the value of sharpening our saws, and I find when you come to these conferences, these specific digital health conferences, it's almost like finding a brand new chainsaw. The ability to be able to be so much more productive with our clinical practices from finding a tool here that I never would have been exposed to otherwise.
One of the most powerful moments is just being able to walk around and network, and be it in the vendor booth or be it during the sessions that are set up to teach us about these various tools. And some of the discussion that happens afterwards is really insightful. And we're thinking future state. What is family medicine going to look like?
I want to congratulate OMD as well for continuing to drive innovation. It's ridiculously hard to drive innovation. It should be much easier than it is. But I know that OMD is definitely a push factor in the whole system.
The digital health space is only becoming more complicated, not less complicated, and I think OntarioMD, one of their particular strengths is their relationships that they have, physicians, frontline physicians, their network of peer leaders, as well as the relationships that they have with a lot of the vendors in the digital health space.
Doctors right now, I think, are completely overburdened, overstretched. They're working jobs of 3 people. So if AI can bring sanity back to healthcare, can help you focus on the patient and bring back the joy of medicine, I think that's where I can help.
One of the things that we need to really do, I think, in the province, and we have, groups like OntarioMD and others that help us as the delivery partners for this, is to almost create a placemat that sits down in front of a clinician so they actually see what the art of the possible is.
The role of OntarioMD is so vital. First of all, let's just acknowledge there is no other profession in the country that has an entity like OntarioMD to support its digital acumen of its professionals and digital integration of all these tools. So having this asset here now, you are already miles ahead of most other health professions in the country, and I would say the world.